Think of it like you call it your health financial statement. You want to think of it like you boldly say that your muscle,
Cool.
this equals your assets. Your muscle equals your assets. You got to think it like your bank account. You got to make deposits. Your visceral fat, that's your debt. You're taking away.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Welcome back to another episode of Health Decoded. I'm your host, Dr. Alessi.
Your co-host, Matt Tack.
Matt Tack. Great to see you, Matt. I'm excited for this episode today. We're going to get back into something and a really cool topic that is basically enhancing the way that we are doing everything within the clinic here at Ascend Functional Health. And I said Ascend Functional Health for the first time on the podcast. We are rebranding from Alessi to Ascend Functional Health. So keep on the lookout for that, everybody listening. But today we're going to talk about a test that honestly I believe should be as common as your basic cholesterol blood test that you get at your yearly physical. Yet very few people have ever really run one of these. It's called a DEXA scan. And so, the reason this is important, because if you care about living longer, preventing chronic disease, staying strong and mobile, and understanding your body composition or reducing your injury risk, then this is for you. And this episode may change how you think about your health forever. The DEXA scan gives you objective data, not guesses, not internet calculations, not a bathroom scale. It shows you exactly what your body is made of and where you stand today, so we can build a plan for where you want to go. And so I'm really excited that this is something we're bringing into the clinic as we move into a larger facility here at Ascend. And really, I want to credit to you, man. It was something you kind of opened the doors on, and maybe I wasn't even thinking that way. So props to you on that, man.
No, I think it just is critical for longevity. People that really just want to figure things out, or they want to be a little ahead of the game, or even maybe they're behind the game and they just want to get a little bit better. You're only as good as the data your body gives you. And so we're all about plugging in that data and the measurables of what we can do and what is cutting edge. We never wanted to be that clinic that was 2 steps behind. We always want to be 2 steps ahead in terms of what we can provide to our patients. And so as I was researching this, I just found it extreme value that we can bring to our patient database of they can know more about their bodies and just being knowledgeable overall. And so we are just bringing so many things in to the clinic that are just so good for our patients. And that's what I'm most excited about is just the knowledge that, number one, we get to give back on this podcast and speak a little bit more about the new things that we're adding into the clinic and how that is going to implement and change lives within families, because they have more information and more knowledge about their bodies and are able to make better decisions.
Yeah, definitely, man. And, it's all about giving more value. It's funny. I was talking to a patient today as we were finishing up an appointment, and I was like, yeah, we're getting a bigger facility because we just like having cool, high technology, functional health things. And we ran out of room here. I was like, there's not another room to add stuff. So we needed more space. So, it's exciting, man, because this is going to really change the way that we're able to help people. So, let's just get right into the topic. Let's start with, what is a DEXA scan? A lot of people probably have heard of it, but aren't sure what it exactly is or haven't heard of it at all. So, DEXA, DEXA stands for dual energy X-ray absorptiometry. Big word. Basically, sounds complicated, but what it means in plain English is it uses 2 very low dose X-ray beams. They pass through the body at different energy levels. Your tissues absorb those beams differently. So fat tissue versus muscle versus bone absorb those energy or those X-ray energies differently. The scanner then measures that absorption. And from that, we can the most precise way on earth, calculate body tissue composition. So in other words, it is the most accurate way to gather compositional data about your body, how much muscle mass you have, your body fat percentage, bone density is very important as we age. And so again, it's not the bioimpedance scale that, even we use sometimes to get some basic data, but it's not that. It's much more detailed. It's not the handheld gym thing you've done before. And it's not just your height and weight, a BMI, which is honestly negligible at this point. So the DEXA is the gold standard in body composition analysis, bone density assessment, and then fat and lean mass mapping. And so the radiation exposure, if people are concerned, right, people are always asking about X-ray, it's extremely minimal, typically less than like a flight going across the country. And realistically, we're all carrying one of these around with us daily that's radiating us more than we imagine. So the scan is painless, non-invasive. You simply lie down for about 10 minutes while the arm scans across your body. Excuse me. And so what does it actually test for? Okay, so a lot of people think body fat. That's what they've heard is like, oh, DEXA is going to tell me my body fat. It does give you that, which is fantastic, but it gives you a lot more than that. So it's going to give you your total body fat percentage, not just BMI. So it's not weight divided by height. It's not just a calculation. It's an actual number based on that, again, that absorbed geometry of the x-rays. And so it's actual measured body fat. And this really matters, Matt, because BMI can lie to you. If you took yours and my BMI, we are more on the overweight side of things. That's because we run heavier with lean body tissue that weighs more. It's more dense than body fat. And so, you know, a muscular athlete and a sedentary person can have the same BMI, but completely different composition of their body. And so the DEXA is going to remove that guesswork and give you accurate picture. And so the other thing that's vital is that it's going to tell you visceral fat. And this is the one that's important for longevity. Visceral fat is the deeper fat that actually surrounds your organs, surrounds your liver, your pancreas, and your intestines. This is the metabolically dangerous fat, which is associated with diabetes, cardiovascular disease, dementia, fatty liver disease, and systemic inflammation. It's a driver of systemic inflammation. So oftentimes people can look thin on the outside, but still carry a high level of visceral fat. The DEXA scan will show that. It will clearly show, and there's no hiding. It also shows us our lean muscle mass, which we know muscle is basically the number one predictor of longevity and health span. Somebody with more muscle mass on their body will live longer, will have less likely for injury, a metabolic disease, those kind of things. So it's going to give you your total muscle mass, and it's going to give you regional muscle mass by limbs. So do people carry more in their legs, their midsection, their arms? And it'll show you symmetry. So if someone has created an imbalance over time, which goes hand in hand with a lot of the physical medicine things we do, we're trying to rebalance and create postural changes. If someone's got their hips shifted to one side and they're using their right side more, they're going to probably have more muscle mass. And so it really helps us identify weaknesses before they become injuries. Helps us get ahead of sarcopenia, which is age-related muscle loss. And it tells us whether the training you're doing is actually working. You know, this is something you and I talk about, is a lot of people go to the gym and they just do a bunch of stuff, but they're not pushing themselves quite enough to stimulate growth, muscle growth or synthesis. A DEXA scan will tell you if what you're doing is working. So there's no cheating this test, man. And so again, muscle is one of the strongest predictors for healthy aging. It's going to lower the risk of falls and injuries. It improves insulin sensitivity. It's going to create stronger bones and better mobility. So that's just independence. As you get older, muscle is number one. And then the last thing is going to test for is bone density. And so this is where DEXA is unique, because we can detect osteopenia, osteoporosis, risk for fractures before someone ever even experiences like a major injury. And so bone density decreases with aging. We know that. Now, it also decreases with hormonal changes, inactivity, so sedentary, nutrient deficiencies, which we catch all the time. Somebody's has a gut dysfunction that's not allowing them to absorb minerals and nutrients. They're going to have lower bone density for sure. And so it'll help us to create a more whole picture of the health of someone's body and get ahead of that kind of thing. Because you're not going to feel declining bone density over time, but we can discover it by DEXA before we have to discover it by fracture. And so, you know, I'll let you kind of get into a little bit of like why this matters, man. I know this hits home for you.
For sure. I mean, that's why we're thinking about, DEXA, and we're talking about it in today's podcast. It is a longevity mechanism. And again, it gives you that data back. So let's zoom out beyond the numbers here. Why does it matter for longevity is the real question, because what mattered what measured gets managed. I don't know how many times I've heard you say that in the clinic. We constantly say that you have to measure things in order to manage them correctly. So longevity, what it's not about, random supplements, just throwing stuff out there, expecting it to stick. Trendy biohacks. I've been there before. I've done a lot of the trendy biohacks. I was like, this isn't working. Right? There's a lot of that, but what is working? Right? And that's the data your body's giving you through a DEXA scan. So the other thing is, posting early morning cold plunge videos is like one of those ones that I tried like every single day. And I'm like, this isn't working for me. So I do a lot of different things now. And I won't say like those cold plunges don't work, but I think we've done a long study on what does work and what doesn't work. And we preach what we've already tried out and what does work. So Dr. Alessi and I both are constantly researching and looking for the tools that are going to best set up our patients for the future and the future of their longevity and how they surround themselves with their family and what those things look like. So what longevity is about is just maintaining muscle mass. We talk about this every day. I plan the end of the year for what I'm actually going into the year with my next training schedule. So I actually map that out. And so I map out 3 months worth of activities of how I'm going to train. That's me going in with intention and then tracking those where I'm maintaining that muscle mass for longevity. Preserving bone density is a major tool that we are actually utilizing a lot through peptides now. So if you haven't listened to the prior podcast already, but we focus heavily on nutrition first and then supplementation second. And so Dr. Alessi's specialty is in gut health. And a lot of that comes down to what your body physically can absorb. And so we help patients out every day focusing on, hey, how can we get you a proper gut so that your body can properly absorb the micronutrients that you need, micro and macro, that you need to have these, like to maintain your muscle mass and your bone density. But then the other thing is like activity. Activity is a major tool in minimizing visceral fat. So we want to make sure that we are implementing these things. We practice what we preach, and that's why we push these things. So minimizing visceral fat is a major component and something that the DEXA scans. The other thing that we always do, and it goes back to like utilizing Dr. Alessi and the team for optimal gut health, is because we want to keep the inflammation low. Any type of supplementation, being macro or micro, we want to make sure that that inflammation is low. And I'll tell you a little bit of story about myself. I mean, last year I was having insane chronic knee pain, and a lot of people would have gone back and said, it's just me getting older. You're 40 now, you're getting older. But I wasn't willing to accept that. I was like, there's no possible way that my knees like are feeling bad. I keep myself in optimal health. Well, my blood work came back and I had high levels of inflammation. And so what did we do? We went through a detox. We got the proper micro supplementation embedded in my day-to-day structure. And now I'm pain-free. I don't complain about my knees. I think Dr. Alessi can attest to that. So it's something that you have to keep telling yourself. These are not age-related symptoms. You are a product of your environment. And if you take yourself out of that environment and become knowledgeable on these things, you can feel better. And the last thing is, about longevity, preventing that metabolic disorder, that metabolic disease, which it pretty much encompasses everything here. But going back to the gut, we talked a lot about the gut and a lot of these Health Decoded podcasts leading up into this. And some of the machinery we're getting is really, it focuses back to that. Let's get the data. Let's get the blood work, get the data with the DEXA scan and all these things, and come back home and build out the game plan and the infrastructure that we need to become the most optimal humans. So the DEXA scan allows us to identify those risks early. And what's really cool about the DEXA scan, unlike blood work, so we need to get blood work, but the DEXA scan actually shows us things on demand. So we get those things back. So you'll get them almost, within that day. You'll get the DEXA scan, and as far as what the visibility that you're showing in your body and those risk factors, and then you can watch your trajectory over time. So as we build out this game plan, you can really, we then are going to bring you back under the DEXA, and we're going to see these things evolve, and it's a progression of how it's making you feel better. So your health plan is just actually working at that point real time as you put your emphasis on the plan and just stay committed to the plan. You actually are seeing these real time results, which is a really, really cool thing. As you come back to the clinic, it's almost like you get giddy to see this data come back real time, right? Not only in your blood work, but physically too. You'll actually see the scans. So think of it like your you call it your health financial statement. You want to think of it like you boldly say that your muscle,
Cool.
this equals your assets. Your muscle equals your assets. You got to think it like your bank account. You got to make deposits. Your visceral fat, that's your debt. You're taking away. You might be taking away some years. How do we get away from that? How we lighten up? Bone density, foundational stability. Everyone says, I heard somebody say the other day that like the majority of people that fall after, I think it was the age of around 75 that break a hip. You know what it's due to, Dr. Alessi? It's actually area rugs. They get up, they trip on an area rug because there's area rugs in the house and they break a hip. The area rugs are one of the top things that actually kill the elderly because their bone density, they don't have the foundation for it and they break a hip and they never can get back after breaking a hip. So how do you get ahead of the game before it's too late? And so that's what we're talking about here, is just getting that data back. We would never run a business blind, yet most people run their health as if they don't see it. They just run it completely blind with blindfolders over their eyes. So that's what I'm most excited about this DEXA, is that we are actually going to be giving people this data along with the blood work and everything else that we do. And then they can see true measurable results from that.
Yeah, that's awesome, man. And, the other thing is also like, it's data, but then data is only as good as what you do with it. And so every time we talk about everything we do, whether it's x-rays, whether it's blood work, whether it's any other kind of gut testing, it's all about gathering data so that we can do something with that. Now, if it's to correct something, yeah, number one, we have to fix what's broken, but then it becomes prevention at that point. And so it's like where you and I are is like, we're always just like running blood work and fine tuning. We don't have some level of chronic disease we're trying to solve, but we are always trying to stay ahead of the game, because I don't want that to ever get to the point of where I'm back there where I was, when I had a thyroid issue. So it's always like I am diligent about that. And the DEXA just adds more value to that. It gives me a better outlook on my health. Like I'm excited to run it on myself every 3 months. So it'll also be like really cool to see that, the peptides and things that we are working with, to see the outcomes of those in real time as well. And the big thing, man, is like the injury prevention and performance side. So, I mean, it's really powerful in the world of orthopedics, sports performance, because it's going to show us that imbalance, if there is any muscle imbalance, asymmetries may be created with patterns, and you can learn what weaknesses you have to prevent some kind of injury. Like specifically for athletes, maybe things like tears or their predisposition to have some kind of injury. And then for the general population, more of the people who are listening to this show, like adults trying to stay active, how to reduce certain injuries while exercising. Hey, you have pretty low bone density. We're going to make sure we're not overloading your spine by doing a bunch of back squats. We're probably going to focus on, general body pulls and things like that, and then strengthening the areas based on where the weaknesses are to protect the joints. And so, when it comes to, that's more on like the physical side. When it comes to like the internal side, so let's talk about the internal side. And this is really where I like to get into, is the visceral fat is associated with insulin resistance, type 2 diabetes, hypertension, heart disease, inflammatory disorders, basically everything. Every metabolic disease people have can be tracked back to high levels of visceral fat and inflammation. And so the DEXA is going to give us insight into metabolic health, even when like labs look normal. Say we ran labs on someone and we're like, this is, looking good, but then they have a DEXA scan done and it's like, wow, visceral fat is really abundant. Then it's like, okay, how do we work on that to avoid these labs getting out of range down the line? And so it's always just more data. And so, I think the biggest one is what we call like the skinny fat. We see a lot of that where people are not necessarily obese or overweight. Maybe they naturally run like more like skinny, like ectomorphic, if you will. But they hold a lot of visceral fat in the abdominal area, which can be, again, disease causing. So you wouldn't catch that with a BMI. You wouldn't really catch that with standard blood work, but you would catch that with a DEXA scan. And so this is how we're going to catch disease before it becomes disease. So, again, like, why don't you go through, because we kind of like set this up, how we're going to integrate it, patients who are already patients and understand the way we operate.
Yeah, no, this is what I'm like super excited about in terms of how this is going to be built into specifically our functional medicine side. So we probably are going to be using it for the physical medicine side, but I'd like to, for this purpose alone in this episode, stay on the or functional medicine side, because this is essentially, you come in, you actually are going to be doing, maybe you're a new patient, it's going to be a day one consultation with a baseline scan. So you would just have feedback right then and there. Let's say then you become a functional medicine patient in our clinic. We build that off of a customized nutrition plan. So you get blood work, you have that baseline scan done, and then we start optimizing from there. We typically take you through a detox very early on. Usually people that are coming into our clinic have some sort of associated gut-related ailment that Dr. Alessi dives deep into by getting back this DEXA scan and the blood work. So, but then we expect that. So we expect this out of our patients to repeat this every 3 to 6 months, ideally every 3 months, because we see progress in quarterly increments. And so we want to make sure you're top of mind, like you see that level of progression through your entire functional medicine treatment. So that's what we actually look forward to, is that every 90 days you have a checkpoint. That's like the flagship checkpoint. You have almost like a progress exam where you'll come in and you'll actually do that. And one of our team of doctors actually sit down and actually walk you through what you've done. If you haven't put in the work, it's going to show it. If you have put in the work, it will show it. And so it's tracked with measurable progress over time. So we ask that you do it every 3 months. And then we pair these DEXA findings with some really cool things that we are doing at the clinic currently, some new and some that we've been doing for a while. So hormone testing, we do hormone testing along with the blood work. We do comprehensive exams. We do a lot of stool work right now in our gut zoomer test. And we do a number of different tests right now that are associated to just getting a comprehensive look at the body, and then specifically the gut too. We can look one or the other, but we dive deep into the gut. Really, Dr. Alessi focuses on there first, and that tells him a lot of signals of what he needs to focus on second and third and fourth and fifth. So the hormone testing is a big thing that's usually layered in primarily with the gut testing first, hormone testing second, and then we go into the micronutrient testing. So we've actually partnered up with a company called Apex Labs, and Apex actually does all of our supplementation. And what's really cool about Apex is that Apex knows the source and the derivative of all their supplementation. So it's not something you go on Amazon and buy and you don't know what's in it. And it's definitely not the right stuff, because they just did a study on all these Amazon supplementations that I think they have about 10% of actual ingredients actually in the supplements, right? Very, very low. You can check me on that, but I know it's low. So the quality of these supplements that you're buying on like Amazon and then even sometimes in Walmart are not what you're getting. So we use the most specific micronutrients along with that testing of actually we can even go break it down to the genetics that actually your body actually physically needs. That's how detailed we can get with it. But we want to look at the macro and micronutrients of how you're operating on a daily basis. We believe in a high protein diet. So we stray towards that. Hey, what type of protein are you getting in on a daily basis? What's our protein goal? And then also, I go into this because I have to say it is, strength training and resistance training is a non-negotiable 3 days a week minimum. You want to have 45 minutes of getting that heart rate variability up and getting that resistance training built in. So we help and guide you along through that process as well. And we have a couple different programmings that we offer to our patients that we can actually hand off, and they can follow that roadmap as well. So strength and mobility assessments are imperative, and it's something that it shows true and measurable results when it comes to this DEXA. So if you blend all these in and then you're coming back to your checkpoints every 90 days and then you see the progression of a year in 2026, I'll tell you what, you are going to look like a completely different human. I mean, this gives the complete picture of both an internal and external health assessment. And here's something I'm really proud of. we are only one of the few locations in Tampa Bay with in-house DEXA scanning. So most people have to go to hospitals or research facilities really that have this in their practice. But our objective is to really get the data behind everything so that we can provide you the most comprehensive functional medicine experience. That's my word of the year, experience that you possibly can have anywhere else.
Yeah, that's awesome, man. That's the exciting part, right? Is like this stuff used to be so out of reach, and that's why a lot of people never did it or don't know what it is. But making it accessible to people, man, like more retail-ish. So one thing that I'm gonna tease this. I'm not gonna give it all away yet, but something I'm working on. And anyone who's been to the clinic or listened to the podcast knows that the way we operate is very much focused on protocols, because a protocol is a system that can be repeated now and then customized per person. But basically, everything we do has a foundational protocol to it, and then we customize it based on the person's goals and needs. And so I'm actually working right now on creating a protocol that basically bundles the DEXA data and what we call our NutriPro genetic panel, which is kind of what you alluded to. It's basically an entire genetic panel that reads your genome and how you respond to nutrition and lifestyle and supplementation and all these things. And then with those two things combined, we can completely dial in someone's like your lifestyle. Like I can straight up tell you how you need to live your life for optimal health. Hey, you need to wake up at this time, ideally get this amount of sleep. Caffeine should be within this window, not after this time. You should work out at this time of day. It's better for your genes, all of that. It's awesome. And so for people who are into that or people who need guidance, like it's done for you, then you just have to do it. And that's everything we do is like, let us do the hard work and build it for you. You just have to then follow through. And so look forward to that coming. We're going to share more on that later, but in summary here, we're just really excited to bring this on. I think this is going to provide tremendous value for people. And so with that, with the new year here and everyone's setting resolutions and everyone's trying to kind of take health seriously at this time of year, obviously we don't want that to fall off, but we are going to be doing something a little bit different. We're offering some discounted rates on DEXA scans, almost like preliminaries, if you will. So we're going to have some discounted rates for single scans, more reduced rates for like membership packages and quarterly scans with that coaching oversight that we talked about. So anyone who wants to learn more about this, I recommend you reach out. You can contact us, info@alessifxhealth.com, or you can, obviously call the clinic. And, again, this is perfect if you're starting a new training program. You just signed up with a coach, or you're like, man, I want to get my fat loss under control this year, build muscle. Maybe you're recovering from an injury. Maybe you're like focusing on longevity and prevention this year, and you want the most accurate health data. Well, instead of guessing, measure it. And so that's what this is for. And so the truth is, your future self depends on what you build today. Chronic disease doesn't start when the symptoms arise. It starts today. And so the DEXA is not just about numbers. It's about clarity, direction, and ownership over your health. And that's something we preach in our mission statement, is giving you the power over your health. So if you're in Tampa and you want to schedule a scan, you want to learn about our memberships and reach out, we would love to help you get your baseline, build a strategy for the year ahead so that 2026 is the best year of your life. And as always, we want to thank you for listening to Health Decoded. We ask if you found value in this, please share this with someone, send it out, follow the show, and subscribe so that we can get this message out to more people who need to hear it. And if you have questions, as always, send them to ask@alessifxhealth.com. That's where we respond. And we hope that this was valuable to you. We appreciate you joining in, and we look forward to seeing you on the next episode.
And as always, your health is in your hands.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.